It's really a great honor for me to be here. I just think the world of Dr. Henschke, Dr. Yankelevich, Dr. Flores, and their wonderful
For some
screening
reason,
program.
people even up front are having a hard time hearing.
Is it
you.
on or on?
Either boost the audio or you gotta get in closer.
Is it on now?
Yes.
Better? Oh, okay, I'm sorry. I'm sorry. It's just a great honor for me to be here with Dr. Henschke, Dr. Yankelevich, Dr. Flores, and the whole team here at Mount Sinai. This is the best place in the world if you're going to get screened. Come right here. These are the top people. 14 years ago, I lost my right lung. I wasn't screened by CT scans. I was screened by an X-ray that never picked up the tumor. And then one day I was babysitting my grandchildren, and like Roz, I started hemorrhaging blood. That was the first clue. So you can imagine, I am a strong supporter now of CT screening for lung cancer. The first time I ever met Claudia was on Capitol Hill. That was my career. I worked in politics. And I was listening to her testify. You might forget this. I was listening to Claudia testify before a committee of the House of Representatives. Oh, there we go. And listening to her speak, it's the first I heard about CT screening. I thought, my God, that makes perfect sense. This is amazing. I then looked into the politics of lung cancer screening. Now remember, that was my career. I was 20 years in politics. I was absolutely appalled at the politics surrounding lung cancer. You heard from Dr. Flores and from Roz and from Claudia the amazing statistics, the number of deaths, the leading cancer killer, only 16% being diagnosed early. The other part of that coin is that of the major cancers, it's receiving the least funding for research. What was happening with this? Why was this happening? Well, for one big reason, it was the stigma associated with lung cancer. And the fact that so many people who get lung cancer, not all, but the majority, are either smokers or former smokers. So the public health policy back in 2000 was we don't have to do anything with lung cancer. We don't have to put money into research. If we just have people stop smoking, lung cancer will go away. That's not realistic. Not realistic at all. Right now, over 50% of new lung cancer diagnoses are in people who already quit smoking, and another 20% in people who have never smoked at all. If you are at high risk for lung cancer, and let's face it, you know who you are. You know who you are. Talk to your doctor, come here and talk to doctors here, and figure out if you should have a screen. The only way that you're going to survive lung cancer is to catch it early. That's your best chance. I shouldn't say the only way because I'm lucky I'm still here. But it's such a simple thing. Catch it early and live. Let it go till late, and you're not going to live. Those are the odds. That's what it is all about. And the problem with lung cancer is it doesn't have that many symptoms. You might be coughing, but everyone has a cough of some kind. So you really have to look yourself right now and figure out how many years did I smoke, when did I stop, how old am I? Put all the pieces together. Talk to your doctor, talk to Mount Sinai here, and decide to get a screen. And I hope you will make that decision. As Dr. Henschke pointed out, we now have the federal government endorsing screening. Now, what that means under the Affordable Care Act is that insurance companies must start covering the cost of screening beginning at the latest January 1 of next year. About a third of commercial insurance companies are already covering screening. And right now, we're working very closely with CMS, with Medicare, to get Medicare coverage also for screening. It's going to be a fight, because everything involving lung cancer has been a big political fight. Dr. Henschke and Dr. Yankelevich are on the front lines in the science, and Lung Cancer Alliance is on the front lines of the politics in Washington. And believe me, they're rough. But we have made progress. There's a lot more funding now for lung cancer research. And we now have government agencies endorsing it. I don't know what else to say to you except that we are here. We also do patient support services. About 50% of our work involves patients. We have phone buddy systems. How many patients are out here in the audience already? No, you're all here because you want to find out about screening. Okay, wonderful. We do have material up in the back that can be of assistance to you. I feel like I'm rattling now because whenever I get in front of an audience like this, I just want to say, if you're at risk, get screened, for God's sake, do it. So with that, I think I better just stop before I go out there and start grabbing you by the lapels and saying, do it. But I thank you, Dr. Henschke and Dr. Yankelevich, for bringing this about, making this happen. They've been 20 years on the front lines, and believe you me, the ammunition was flying back and forth, and it's still kind of flying. There are a lot of different reports and articles out there saying that lung cancer screening is too complex for people to figure out. Some of them are even saying it's too complex for the family physician to figure out. Not so. It's very simple, like Dr. Flores showed you. You're at risk, you meet certain qualification, get a screen. So I'll stop repeating that over and over. I think you get the point. So anyway, thank you very much for having me here.